pain here?
No, but just now that part a bit itchy.
This one? Any tenderness here?
Not pain, but it's like, yeah, like itchy.
Okay,
like
yeah, bruising kind of sensation.
Huh?
Bruising kind of sensation.
Bruising sensation.
Right side slightly lower, and the left side is higher.
Yeah.
Okay.
Always do leg raise, I can feel one side is more.
Yep. And when I put my finger here, it's obvious that the left side is higher, the right side is lower, because the right side of the ilium, the pelvis, has dropped down in this direction and outwards. So it gives this kind of appearance. When I on this, I have heat here. So when I put it over here, the needle will run towards this side, and when I put here, it will come across this side. When there is enough temperature difference, and then it will deflect and tell me potentially that something wrong on that level.
So it's like such.
Yeah. Patient like this.
Yeah, the pressure is quite
Soothing.
yeah.
Same thing, oftentimes when that segment is not functioning properly, when I press on that particular segment, patient will be feeling pain. It's blocked on the side. And you're probably having pain here.
Pain.
When I press on this one,
yeah.
compared to this one,
Yeah.
more on the left side.
A lot, yeah.
Still checking Jordan here because he's a big guy. You can see that the muscle is so thick. It's easier for me to lay him down in this direction and then just check for the spinous process. Pain here.
Yeah. So you can feel
Yes.
you can feel by just touching.
So after touching 1000 knot spine, that's what we are trained for, and it's quite consistent. Most of the time it's consistent with the reading of the meter. So just now I mark on this spot and this spot. These two spots are potential spot that there is segment that is dysfunction. So exactly at this one he's feeling pain. Now we have Jordan's x-ray here. As you can see, as a chiropractor, I look at the x-ray differently from a medical doctor because I flip the x-ray around. This is the right side, this is the left side, because when I check the patient's back, this is exactly how I look at them. And just now, when I checked Jordan, the problem is on the right side, and if you can recall, I told that the pelvis is twisted backwards in that direction. And as that happened, when it twisted and stuck in that position, it will actually give an image that it's longer on the right side compared to the left side. And also because of the pelvis is sitting at a 45-degree angle, as it's tilted backwards like this and stuck in that position, it will change the height of the obturator foramen and also the angle of the pelvic inlet. But of course, I'm not going into detail of that. And because the right side of the joint, it's stuck posterior, to compensate for that, the sacrum will be tilting forward to compensate for a pelvis that it's stuck backwards. And you can see there will be a increased lumbosacral angle here. And why also we take x-ray is to rule out any contraindication to push into spine. Like for this patient, you can see that the L4 is forward of L5, and oftentimes when I ask patients do they have any trauma, a lot of them can't actually recall it. But when once x-ray show up and I told them you have serious fall before, then you'll say, oh yeah, a few years ago. I don't recall it until you told me that. And when that happened, when the spine has already slipped backwards, say the L4 is already forward like that, I don't want to push forward more. That will actually compromise on the spinal nerve. Okay, so definitely we need x-ray to confirm on our findings. And also if you can have a look at this, This is a guy that's about 30 years old, but he already has quite a bad degeneration on the L5 disc, so that actually also doesn't correlate with the age. So it gives us a lot of extra information that I needed before I started to treat the patient. So after adjustment, I always tell my patient, use your hand to push your body up, bring your leg down, so that you don't get up the bed like.
So use my hand to push up.
Bring your leg down first.
Bring your leg down.
Yeah, and then push yourself up. So that's a proper way of getting up from the bed, especially if you're having lower back pain. Okay? So sit here.
Feels good, man. Much better. Yeah.
Feet forward a bit. Okay, I want to take a deep breath in, all the way up. Okay, yeah. Can feel immediately, yeah, the difference in this direction compared to just now. Close to similar now, yeah, compared to just now. Okay, that's all that we'll be doing for Jordan today. Okay?
Yep. Okay, thanks, John. I'll see you. Right, and remember to train smart. You don't want to get injured first, then when you consult a chiropractor. But of course, get to check out once a while. It's
Definitely good for your overall health.
yeah. Signing off.
See you. Bye.